It's my pleasure to introduce Dr. Navneet Kaur with the City of Hope. She considers palliative care medicine to be the truest expression of her calling as a physician. She embraces the role of being there for patients and their loved ones during their toughest moments with a treatment philosophy based on compassion, empathy, and respect. Thank you again, Dr. Kaur, for joining us, and over to you.
Thank you so much for the introduction. Hello everyone. I couldn't be there today, but I'm happy to be here virtually, so thank you for having me. I want to apologize in advance if you hear my dog barking in the background. He's behind doors, but the barks can sometimes get through. I will be talking about evidence-based integrative medicine in oncology today. And I am a part of the supportive care medicine department at City of Hope. So let's jump right into it. So what are our objectives today? So we're going to be defining the categories of the complementary alternative and integrative medicine, or CIM. We'll be discussing some definitions, and we'll be discussing specific evidence-based integrative medicine techniques, and also talking about resources that are available for patients, caregivers, and providers. So I have no conflict of interest. So there are 4 categories of the complementary, alternative, and integrative medicine. And the 4 categories are the nutritional or natural products, which include special diets, dietary supplements, herbs, probiotics, psychological, mind-body, which include meditation, prayer, mindfulness, physical or body-based category, which includes massage, spinal manipulation, and osteopathic sources, and combination therapy, which includes yoga, dance therapy, art therapy, or traditional Chinese medicine techniques like Tai Chi, Qigong, or acupuncture, energy therapies like Reiki, or relaxation techniques such as breathing exercises, guided imagery. So what are some common approaches that were present at this time in 2012? This is a statistic that was taken off of the NIH site. So the most common was natural products, deep breathing was the second most, yoga, Tai Chi, or Qigong came soon after that. So let's move on. To give you some definitions between all the different terminology and things that you've probably heard, it probably is a little confusing as well. So just to go into it, conventional medicine is Western medicine, refers to chemotherapy, medicine that treats the disease, like I said, chemotherapy, surgery, radiation, immunotherapy, etc. So alternative medicine is medical therapies that include homeopathy, acupuncture, herbalism, and then complementary medicine combines alternative and conventional approaches. And functional medicine is a scientifically based approach that focuses on the roots of the disease and prevention with treatment for the patient and not rather than the illness. So what we'll be talking about mostly today is integrative medicine, which combines conventional and alternative medicines in a coordinated way. And the big point here is emphasis is on data-driven solutions that are safe and patient-focused. So what is integrative medicine? It combines with conventional treatments for cancer to help patients cope with symptoms and side effects of treatment. It is a holistic modality or whole body modality that delivers evidence-based, patient-centered care, and it utilizes all appropriate therapeutic approaches and healthcare professionals to achieve optimal health and healing. So what are alternative therapies? And if a non-mainstream approach is used instead of conventional medicine, it's considered alternative. For example, instead of chemotherapy, if there is an organization or person promoting taking a particular herb, particular infusion, avoiding specific foods, that's considered alternative therapies. And these are disproved or unstudied. They do not treat cancer, and they also might be harmful. So whole person or holistic health It helps individuals, families, communities, and populations improve and restore their health in multiple interconnected domains, which include the biological, behavioral, social, environmental, rather than just treating the disease itself. And research on holistic health includes expanding the understanding of connections between these various aspects of health, including connections between organs and body systems. So this goes into the holistic health model, which shows that the outer core is consistent of the psychological, social, spiritual, physical domains that make up a patient. And then the inner circle includes the different treatments that would go into treating cancer patients, like surgery, chemotherapy, immunotherapy, stem cell, radiation. And then the patient's inner core, which consists of family, their culture, environment, their beliefs, values, etc. So going outwards to the psychological domain, I highlighted a few points here. So music therapy, art therapy, yoga, meditation can affect the psychological domain. And part of the physical domain, palliative medicine, integrative medicine, acupuncture, massage therapy, etc. So why are we even talking about this today? So there was a study that was done in 2018, actually a survey at the University Hospital in Mannheim in Germany that collected data from 325 patients with biopsy-proven sarcoma, GI stromal tumors, and desmoid tumors. And 51% of these participants had used integrative medicine in their lifetime, and 15% of them strictly during treatment for their disease. So why would people be interested? So these are self-reported responses. They wanted to boost their immune system, help them feel better, cope with cancer treatment, reduce stress, manage symptoms or side effects. So we'll talk about the first category next, which is the nutritional or natural products. Sorry, this is a funny thing I came across. So the American Cancer Society guidelines on diet and nutritional activity for cancer survivors in 2022, they put out some recommendations. The general is nutritional and physical assessment, and counseling should begin as soon as possible after diagnosis. And the recommendations to improve long-term health and increase the likelihood of survival, general things like avoiding obesity, maintain or increase muscle mass through diet, physical activity, have regular physical activity, healthy eating patterns, and follow the ACS guidelines for diet and physical activity to reduce the risk of new cancer, which I'll go into next. And first is achieve and maintain a healthy body weight. Be physically active for adults. This is 75 to 150 minutes of vigorous intensity physical activity. And once I want to specify over here and make a point that this is a generalization. There are many people that are not able to do this. Physical limitations, other limitations. So I would recommend working with your provider and a therapist, a physical therapist, to figure out what would be the best treatment strategy for you. Children and adolescents, at least 1 hour of moderate intensity. And eating high nutrient density foods. Limit or avoid red or processed meats, sugar sweetened beverages, highly processed foods, and refined grain products, and limiting your alcohol. So this generally is about avoiding alcohol or limiting it to 1 drink a day for women or 2 drinks a day for men. So the biggest thing I wanted to talk about in this category was that is all included in this slide. So what are the risks associated with this? There are risks of interactions. There's been many documented interactions with this. There's increased toxicity. So it combines with your chemotherapy, immunotherapy, or other medications you're on to increase toxicity. And there is a high risk of contaminants or toxins in products that are not regulated. There's been studies that show that like 50% or more of a natural product can have contaminants in it. Loss of efficacy of anti-cancer treatments. And there's also very limited research on these medications or products. So the main thing over here as well is to make sure to always discuss these products with your oncologist or with your provider. So these are some documented interactions in some studies. Beta carotene during radiation can reduce the efficacy of radiation. St. John's wort interacts with irinotecan, docetaxel, and imatinib. Green tea can affect bortezomib. Ginger, garlic, ginseng have some anticoagulation properties and can interact with imatinib and docetaxel. So this is a study that was published by a group of researchers from the Mayo Clinic in 2013. This refers to Wisconsin ginseng specifically, that was studied to help improve cancer-related fatigue. And they found really promising results. So at the 8-week mark, they found that people reported significantly improved fatigue scores. So Wisconsin ginseng is a medication or herbal supplement I do prescribe sometimes for appropriate patients. So the next category that we'll be talking about are psychological or mind-body practices. Another funny meme moment. So I want to talk about this slide a little bit in detail. So these are some guidelines that ASCA recommends. So when you'll see the grade A or grade C at the side, that means that there's different grades that we have in research that tells you if you highly recommend it or you don't. So grade A means we highly recommend this, discuss this with your patients. Grade B is there's a moderate benefit, still discuss this with patients. Grade C is there may be a minimal benefit, but you can still discuss it with appropriate patients. So we found that psychological or mind-body practices can help reduce stress, mood disturbance like depression, anxiety, and improve quality of life. These are all grade A recommendations. And they can also help with insomnia, which is a grade C recommendation. So the next category that we'll be talking about is physical or body-based, just like massage or osteopathic manipulation. So what is oncology massage therapy, and why would we be interested in it? Well, I hope everyone's had a massage in this room before, but what are some research studies that, some things that research studies have shown is that it can significantly help with mood disturbance. And this is a moderate grade recommendation. The grade C recommendations are that it can help reduce anxiety and stress, pain and constipation. As for the others like depression or neuropathy, the reason they're not graded is either the data hasn't been sufficient or they haven't been studied enough. So a study published in the Annals of Internal Medicine shows that massage therapy, so they studied massage therapy versus simple touch to improve pain and mood in patients with advanced cancer. And as you can see, actually the dots are probably really small, so I apologize, but I'll point out that the patients felt an immediate effect, a good effect in mood and pain. So the sustained side effects were not so evident. Now, talking about physical activity as well in this section, I wanted to put this over here for patients that don't have access to a physical therapist, or they just want to learn more about activities that would be beneficial. You can go on this website and they have links and worksheets that you can download that can have you doing some exercises at home or movements at home. The YMCA Live Strong program is also another good resource. So the last category I will be talking about are the combination therapies like yoga, dance, or art therapies, traditional Chinese medicine like Tai Chi, Qigong, or acupuncture, energy therapies like Reiki, and relaxation therapies such as guided breathing exercises, guided imagery. So there was a trial that looked at multiple centers and the effect of yoga for sleep quality amongst cancer survivors. And this trial was published in 2013 in the Journal of Clinical Oncology, and it showed that yoga improved sleep quality, sleep duration, efficiency. It improved or reduced daytime dysfunction, reduced sleep medication use as well. They did not find a significant improvement in sleep disturbance. So our next topic is Tai Chi and Qigong. So what are these two? So Tai Chi is a form of Qigong, and it's a practice that involves a series of slow, gentle movements and physical postures, a meditative state of mind, and also controlled breathing. And it originated as an ancient martial art in China. So Qigong, there's hundreds of types of Qigong, of which Tai Chi is the one of the martial art categories. And Qigong itself has psychological and physical components, and it allows you to regulate your mind, breath, and body's movement and posture. It uses exercises to optimize energy within the body, mind, and spirit with the goal of improving and maintaining health and well-being. And it is also a very, very ancient traditional Chinese medicine technique. So I wanted to bring up a couple of studies associated that talked about Tai Chi and Qigong, and these are just a few of hundreds. There are many, many different studies out there. So the first one is a 2019 review, which looked at 915 people with different types of cancer. These patients or people participated in an average of 60-minute sessions 2 to 3 times a week for about 6 to 12 weeks. And they found that Qigong significantly improved symptoms of fatigue and sleep quality. A 2017 review, which looked at 1,751 people with various cancers, found that using Qigong was promising for managing physical and psychological symptoms related to cancer and its treatment. These are the titles of the studies that I just discussed. So the first one looked specifically at women undergoing radiotherapy for breast cancer, and it showed improvement in fatigue, depression, and quality of life. The second study it took data that was self-reported from patients and caregivers. And it showed that there was a reduction in physical distress, improvement in well-being, and fatigue. So what is acupuncture? And I can't talk about acupuncture without talking about Qi, which is the vital life force energy that flows along the meridian points of the body. And acupuncture, the purpose of it is to open up the flow so that this energy flows through your body uninterrupted. So there were several randomized controlled trials. So let me talk about what a randomized controlled trial is. These trials look at 2 categories of people getting this treatment and people that are not, and then they look at differences that are reported in these symptoms. So the main one I wanted to talk about is the grade B recommendation, which, quick reminder, means that there's moderate success, so people should recommend using this for their patients. And it showed that chemotherapy-related nausea and vomiting, there was a significant improvement. The other grade C categories are pain, cancer-related fatigue, dry mouth, hot flashes, neuropathy. Insomnia, anxiety, and depression were studied but didn't really have good data. All right, so what do we do next? What do we do with all this information? So the NIH has a section of it called the National Comprehensive Cancer, sorry, I misspoke. So the National Comprehensive Cancer Network has posted guidelines for palliative care. And for these 3 symptoms, they discuss some recommendations that they have for alleviating or relieving them. So for pain, they recommend using acupuncture, mindfulness-based stress reduction, and relaxation therapy. For nausea and vomiting, recommend acupuncture, acupressure, hypnosis, and cognitive behavioral therapy. There was a recent, but 4 years ago, study that was posted in the Journal of Clinical Oncology that looked at integrative therapies during and after breast cancer treatment. And the American Society for Clinical Oncology looked at all these studies that were initially reviewed by the Society of Integrative Oncology and recommended them. So for meditation and yoga, they found that it improved stress and anxiety, mood disturbance and depression. Acupuncture helped nausea and vomiting. Music therapy helped stress and anxiety, and also mood disturbance and depression. So what are some resources that you can use at home or in your daily life? So the previous presenter also talked about the Golter Gate, and I wanted to reference it again. The quote is actually quite wonderful. There is no profit in curing the body if in the process we destroy the soul. So you can log into cancer.net and into their integrative medicine website or webpage, and you can scroll through it and look through what interests you, get more information. Another resource is the Society for Integrative Oncology. And the NIH also has a sector of it devoted to this as well, called the National Center for Complementary and Integrative Health. So that is the end of my lecture. Thank you so much for listening. Does anyone have any questions?
This was really a great talk, and thank you so much. Hi, we're going to be able to get these slides because really, how do we refer our patients for like the Tai, not the Tai? How do we refer? Like,
sorry, I accidentally muted myself.
It's okay. Yeah, like about because I mean, there's statistically significant improvement with that. So we do have acupuncture available at University of Miami, but I wanted to know more about how we get our patients involved in the yoga. I mean, we have some, and the Tai Chi or the Tai Dong.
Mm-hmm. So most hospitals have, most cancer centers have a supportive care department or resources where they have information about community centers that they would recommend. So I would recommend speaking to your social worker, or if you do have a palliative care department or supportive care department, asking them. I can't tell you exactly in Miami, but one of the other things you can do is go on the websites that I included on this, and they do include resources and information on and places that would offer these type of treatments. But the easiest and quickest would be to speak to your doctor, your social worker, or your supportive care physician.
Hi, Dr. Kaur. I have a question for you. Can you elaborate on music therapy? I'm very curious about what that means.
Yeah, so we actually have music therapists at City of Hope as a big part of our Biller Resource Center. And music therapy itself is where you either have like a one-on-one session or in a group session where a live artist comes in, or you utilize different sounds and modalities. For example, the biggest one that I found in these studies was classical music, things like piano, etc. And they found that just playing these and also having a therapist or someone to talk to them throughout this, to guide them through relaxation and breathing techniques and graded relaxation therapy, really significantly helped people find that anxiety relief and stress relief. So this isn't like simply where you put on, your Spotify and listen to that, although that can be helpful. This includes a certified therapist. Hopefully that answered your question.
Are there any other questions from here in the room? And do we see any more Kaylee's from, So thank you so much, Dr. Kaur, very much for joining us. I wanted to let everyone both here and joining us via Zoom know that Dr. Kaur's slides will be posted on our website post-exchange. And we are going to do a quick reset of our, oh, sorry, wait, one more question. Stand by, there is one that came in.
So I'm reading, can you recommend a CD that we can purchase that provides the benefits of music therapy? That I honestly, I'm sorry to say, I don't know. I will have to look into that. I wonder if simple, I will actually have to ask my department about that. I'm sorry, I'm not sure.
Just feed it back to me and I'll make sure it's distributed to the audience. So.
Sounds good.
Yeah. Anything else? Well, again, Dr. Kaur, thank you very much for joining us, and we will be posting her slides post-exchange.